So when I was admitted in the university, I had to travel from my remote village in Amuria to Kampala to join Makerere University. Now that's the time when I actually started seeing cases of HIV. You would see people who are thin walking along the road. Then people would begin telling you that, have you heard of a disease called the slim? Actually, because it makes people thin, in Uganda in the beginning it was nicknamed slim. The sight of these people would really scare you. And then I remember at that time, people even feared to touch or to go near somebody who is thin. There was a lot of stigma and isolation that were attached to these people. So I got a call from home that, you have a sister who is not feeling well and she's sick. I told them that, okay, let her come to Kampala and I take her to check because I was working in the hospital then. When they tested and found she was HIV positive, they didn't tell her. So my colleagues called me and said, Dr. Esiru, do you know what? I said, no, your sister actually has HIV. I said, no, my sister can't have HIV because she has been in the village. So I remember I took her to talk to this doctor, and then eventually the doctor disclosed to her. I remember when she came out of the doctor's room, she didn't want to talk to anybody, including me. But I knew that they had disclosed to her, and she was really finding it hard to accept. At that time, again, there were no drugs. So what we were doing is just symptomatic treatment, good nutrition, and then continuous counseling. And I remember we kept that secret until eventually she became weak and we lost her. So eventually, once my sister passed on, we took her for burial and we buried her in their husband's home. So later, with time, I called the husband, so he came with a child, because now my worry was that maybe the mother had transmitted the infection to the child. So according to him, the child had started falling sick frequently and so on. They screened and found actually the child was HIV positive. So my biggest hurdle was how to disclose to the father that the child actually had HIV. It was really a very challenging moment. I remember when I told him that, he broke down into tears. I remember the baby wasn't enrolled on treatment then. It was then difficult to get on treatment. So along the way, we also lost that baby. That child died. So after that, I say, what contribution can I make as a person, as an individual, to support the community? We decided to initiate a PMT City Clinic in Zambia Hospital. So slowly, actually, the PMT City Clinic expanded. We eventually, that time now, we got the single-dose nevirapine program started in the country around 2001. So we adopted it in our clinic and started giving women, pregnant women who are testing HIV positive, single-dose nevirapine to prevent transmission. When the drugs came in, the name Slim also died off because we no longer were seeing people who were so thin, who were slim, like the disease. Yeah, I think the issue is that we haven't yet discovered a cure for HIV. And I think until we discover the cure for HIV, we still need to fund services to prevent transmission of HIV, as well as funding research that is trying to get a cure for HIV. Because we don't want to lose the gains that we have already achieved over time. And if we stop funding HIV, my worry is that there will be a rebound all the complications and the resurgence of HIV in many countries, especially the low-income countries, and then we shall go back to square zero. Why should a child be born and die out of HIV? Where they are born with HIV, we should support them to live healthy lives. So my passion is really to make sure we eliminate pediatric AIDS. And through eliminating pediatric AIDS, we hope that we shall have an HIV-free generation. And I really look forward to a time when HIV is no longer a public health problem. And I think there we shall say we have done something.